welcome to our webinar on telehealth for therapy practices. My name is Robbie Leonard. I am a physical therapist, and some of you will recognize the voice or the appearance. I teach the billing coding documentation course for Rehab Essentials in the University of Montana. And I was asked to put together this webinar on telehealth to discuss how we can use telehealth in therapy practices. And what prompted this discussion is today is April 4th, 2020. I don't usually date these presentations, but it's important to understand where we are in this date and time. And so we're in the middle of dealing with the COVID-19 pandemic. And many therapists are looking for alternative delivery models in order to continue to treat their patients, take care of their patients while we are experiencing this unprecedented time. So our purpose today is to look at the telehealth delivery model for therapy practices and how this could be set up and used with your patients. So without further ado, we'll jump right into the presentation and talk about telehealth for therapy. And I want to make a distinction here. I'll probably have some outpatient therapy examples, but realize that telehealth is not an outpatient specific delivery model. That telehealth has been used for many years, so it's not new. And it's been used in both the inpatient and the outpatient settings and home health settings. But it is certainly a new thing for us to think about doing telehealth as our primary mode of providing care during this whole pandemic time. So a lot of us are being thrown right into the telehealth fire of trying to get our systems set up and get our processes in place so that we can provide this mode of service during this crisis timeframe. So first of all, what is telehealth? And so telehealth, just by definition, is use of digital technologies to deliver medical care, health, education, and public health services. And like I said, telehealth is not a new delivery mode. Telehealth has been around for quite some time, but it's probably new to us from a perspective of thinking about using telehealth as our primary means of treating our patients for a period of time. Some practices have been using telehealth for several years. Some practices use this mode of delivery as an adjunct to their in-office visits, but we're in an unprecedented time of people trying to get this up and running so that they can continue to treat their patients and protect their patients and protect their employees during this pandemic of COVID-19. For therapy, telehealth is typically done by using a synchronous two-way audio-video technology, and we'll talk a little bit more about what that means. What telehealth is not is e-visits or phone calls. And so our next session will deal specifically with coverage of e-visits and what is an e-visit and how is that different from telehealth. But for this first session, we're going to focus specifically just on telehealth itself. Why is telehealth important? There's been evidence that shows that using telehealth helps you improve patient outcomes and access to care, especially when patients are having difficulty accessing traditional care. And we are certainly experiencing that right now. Telehealth can assist in removing barriers of time and distance and provider scarcities. Typically, telehealth is seen as an adjunct to on-site therapy services. But as I said earlier, we're kind of living in an unprecedented time frame where many of us are live in states that have been are under governor's orders to stay at home. And many of us treat patients that are in vulnerable populations. So we're trying to look at our alternative models to continue to be able to treat our patients, but keep everyone safe. So telehealth is certainly one of our options that we can use during times of crisis like this COVID pandemic to keep patients engaged in their plans of care and safe at home. Let's look a little bit at the definitions and the terminology used when we look at telehealth. So there's 3 words that are used to describe telehealth services. The first is telemedicine, and usually when that word is used, that is specific to the delivery of medical services. So specific to physicians or non-physician practitioners delivering medical treatment via a telemedicine or telehealth platform. So the broader terminology is telehealth, and that is delivery of any sort of medical services by a medical practitioner, such as physical therapist. A little more specific is the word telerehab or e-rehab, and that would be specific to the delivery of rehab services through technology over the internet. But for purposes of this webinar, we'll use the word telehealth, which is the broader terminology of delivering healthcare services through this audiovisual technology through the internet. You may hear 2 terms as it relates to telehealth. One is synchronous delivery, and the other is asynchronous delivery. So synchronous delivery is live 2-way interactions between a person and a provider using audiovisual telecommunications technology. And it's just like an in-person office visit, but instead of the person being in front of you, being in the office or in the facility, the patient is at home and using their video audio technology. We're real time, we're live with the patient, we're giving them instructions, we're telling them what we want them to do, we're telling them how to position themselves, and that is that live 2-way synchronous delivery. The other terminology, asynchronous delivery, might be where you store information and forward it to the patient. So let's say doing their home exercise program and delivering that to them via a video, but you're not actually live interaction with the patient, or secure email delivery of their home exercise program. So when we talk about telehealth in this particular webinar today, we are talking about specifically about live 2-way audio visual interaction with your patient. And so that's going to be our scope for this particular webinar. So you might ask the question, is telehealth effective? And there are a good number of articles written about the subject. Like I said, telehealth is not new, and it's not new to the therapy world. So I would encourage you to do a literature search using the term telehealth and physical therapy, or telehealth and rehabilitation, and look at the information that you find. I just want to give you a few articles to bring to light, but just realize that time does not allow us to go through all the literature that exists. But just a couple of examples of the literatures out there. A UC Irvine School of Medicine study recently revealed that telehealth PT was as effective as in-clinic therapy for improving upper extremity motor control post-stroke. So you might be thinking, what patient populations are appropriate for telemedicine or telehealth? Let me use the right terminology. And it's not limited to your orthopedic patients. So something to consider. According to another article, there was a high level of agreement between an in-clinic PT diagnosis and a diagnosis obtained via telehealth using a remote diagnosis and a functional movement screen. So you might think, well, I might be able to treat my patients that I've already evaluated and have a relationship over telehealth, but can I really treat a patient that's brand new? Can I evaluate them using this technology? And there is evidence to show that you indeed can do that. In a third video that you're going to watch, we're going to have a telehealth session that you'll be able to watch for both an evaluation and treatment session, so you can get an idea of what does this really look like using this technology. And one last study to just to show you some of the evidence that's out there, and this is, like I said, not even scratching the surface, but 54 patients who were diagnosed with knee osteoarthritis were divided into two groups. One was office-based PT and the other was telerehab. And both groups improved in their KOOS scores, and there was no significant difference between the telerehab and the office-based groups on the studied scales. So these are just some examples of effectiveness, but I would encourage you to go do a literature search and see what's out there. So we've all seen this graph during this period of time of flattening the curve. And all of us as therapists want to do our part to flatten the curve. And so telehealth is one of our options that we can utilize to do our part to flatten the curve. We want to make sure that we're continuing to see our patients in an appropriate way. There may be some patients that absolutely need to be seen in the clinic, and those will be clinical judgment calls that need to be made. Many of you are working in hospitals. You are seeing patients face to face. But for those of us who work in the outpatient environment, we have patients where it's not appropriate for them to come to a clinic. They're concerned about coming to the clinic. They're scared. Can we use this type of technology in order to see those patients and keep them moving, keep them safe, keep them active, keep them engaged, keep them working on their plan of care, which keeps them out of the physician's office, out of the ER, out of those areas that need to be focused on other things right now. So this is one of our ways that we can deliver care in an alternative format and do our part to keep our patients healthy and well and out of environments that might not be safe for them. So you might say, well, Robbie, I'm convinced that we need to do this, but what are the steps? How do we get started? How do we implement telehealth in our clinic? So we want to walk through just 10 steps that you should think about in developing your program and getting people in your clinic up to speed with this delivery model. So the first thing that you're going to need to do is determine what kind of telehealth platform are you going to use? How are you going to deliver this care? And so there are many, many telehealth platforms that exist in the marketplace, but you need to make some good decisions on technology that you're going to use. The first thing that I'm going to recommend that you choose a platform that is HIPAA compliant. Obviously, compliance is one of my things, so you can imagine that I think that's important. But a HIPAA compliant platform provides you a secure environment to deliver this service. Now, as part of this COVID-19 pandemic, we have had some of our rules relaxed as far as HIPAA goes. So there's actually currently a waiver about providing telehealth services through non-compliant technology, through non-HIPAA compliant technology. But if you're going to put together a program, I would just encourage you to look for a HIPAA compliant program just to minimize your risk, and also to think about the fact that you might want to continue doing some telehealth visits once the pandemic has resolved. So makes sense to choose a platform that you can continue to use. A HIPAA compliant platform is going to give you a business associate agreement for your business so that you have that assurance that they're safe and secure, and they're going to protect any patient health information that's transmitted. One of the most important things that I think you ought to look at when you're choosing your technology is this platform easy to use by both your patients and your staff? Most of our clinics see a wide range of demographics for our patients in age and technology savviness. So, and probably our staff are the same way. So we want to make sure that we choose a platform that's easy for the patient to access, easy for the staff to use, it's easy to connect, and it's easy to get on and be connected to each other. You want to use a platform that's compatible with multiple types of devices. We don't all have iPhones, we don't all have iPads, we don't all have the same type of computer. Some of us like to use Internet Explorer, some of us like Chrome, some of us like Safari. So you want to make sure that you're using a platform that works on multiple types of devices and browsers so that there's no limitations in connecting with your patients. We want a cloud-based type platform that works in the cloud so that we don't have to store information on servers, which can be a problem with, especially with audio and video technology. At the end of this webinar, you'll see a list of resources, and I would encourage you to check out the impact article that's on the reference list for a list of known platforms for therapy providers. The last thing to think about is in the platform that you're choosing, what kind of technical support is available for that platform, and does that platform provide any education for the therapist in use of that particular platform. The next thing that you want to do on your list is step 2 is check your state practice act. So each of our states has unique practice act and then rules and regulations that go with that. And the questions that you want to ask when you're reading that practice act is telehealth included in your state practice act? And are there any limitations to what you can do in the use of telehealth? And so specifically, you want to look for instructions in your state regulations. Does your state require you specifically to identify the patient through a photo ID, for example? Is there a requirement that you have a specific consent to treat via telehealth? Are there any specific documentation requirements? Any specific licensure requirements? Many times states will put in their practice act that if you're going to perform telehealth in that state, that you have to be licensed in the state where the patient resides. So that's important, especially if you live in a state where you're close to a state line and you might see patients that live over the state line. You would want to check both your current where you live and your state and the state next door to you to see what their practice act says, and then also make sure you have a license in the state where the patient is located. There might be some limitations on who can perform telehealth. Does your state allow both therapists and assistants to provide telehealth services? If you work in a multidisciplinary clinic and everyone's going to do telehealth, then you'll need to check both the PT, OT, and speech language pathology practice acts. In addition, you want to look in your state to see if there's any other laws related to telehealth provision in your state. Some states have a specific telehealth act or telehealth law that's not specific to a discipline. So you want to double check for that information as well. Step 3, check your liability insurance. Most of our traditional liability coverages for therapy services will cover you for both in-clinic and for digital delivery of services. But you definitely want to call and ask or check your policy and make sure that you are covered for this type of delivery of service. There are some unique risks to telehealth that we don't experience in the clinic. So obviously when you're doing audio video transmission, there is a different concern in safeguarding that information during transmission. So that is why we recommend, or I recommend, that you use a HIPAA compliant platform, because even though the federal law says that during this time of crisis we have some liberties here, I would still want to make sure that I'm safeguarding my patient's information. How about keeping the information safe during the session, especially if the therapist is performing the visit from home? So during this pandemic, many of us are working from home, and we're working from home with kids in the home because they're not going to school, and our spouse is also working from home. So do you have a safe and private environment so that when you're conducting your sessions with your patient, that you're keeping the information private and your family members are not overhearing the information? You want to have an informed consent for telehealth. You want your patient to understand how telehealth is different from the in-office visit, that there might be potential problems during a session. You might lose a connection. You might not be able to see everything clearly. And so you want to have a specific consent form for telehealth and outline how what the risks are for a telehealth session. You also want to have an emergency plan. What are you going to do if the patient has an emergency during a telehealth session? We'll talk about that a few slides from now. And then you want to make sure that all of your staff have appropriate education and training in this method of delivering care. You don't want to just get everybody a computer and say, hey, have at it, without appropriate training. And then I would make sure that I was documenting all that training and checking off for competency, that a therapist has the competencies to perform this type of delivery of service. Step 4, evaluate your equipment needs. Some of the literature says that the appropriate internet speeds for delivery and reception of telehealth services is a 15 megabits per second download speed and a 5 megabits per second upload speed. That's not dramatically fast, but you want your therapist to, especially if they're going to be delivering these services at home, they want to check their speed. You want to have a capability for your patients to check their internet speed. There's lots of speed test programs out there that you can run fairly simply. But again, having that information. Obviously, your therapists are going to need to have the appropriate equipment, laptops, computers, tablets, an appropriate microphone. I have a nice professional microphone because I do this a lot. But, the microphone on my laptop is not near the quality as my other microphone. So you're going to want to test those things out. In fact, I had a computer with the laptop microphone just squealed on the other end. So that would not have been appropriate for a telehealth session. Camera, what kind of camera do you have? What kind of quality camera do you have? Can you get the view that you need? And that sort of thing. Then the environment for the clinician needs to be a professional background. It needs to be quiet, and you need to have some privacy, and you need to have some space to move. In my setting currently, I have a U-shaped desk that kind of wraps around me. Wouldn't work really great for demonstrating movement patterns to my patients. It works good if you're sitting in a chair. So you want to make sure that you have the right environment for delivering the service and having the right equipment. The next step is your process development. Not all patients will be appropriate patients for telehealth. First of all, does that patient have the appropriate equipment? Do they have a computer? Do they have a camera? Do they have a phone that they can use for this type of service? I would say that phones are probably more difficult than a tablet or a laptop. A lot of our patients have tablets these days. So again, is the patient appropriate for the delivery of service? If your patient is primarily a patient that requires manual therapy, and that's the key thing you're doing with a patient, that might be difficult to do. You need to determine how much time do you need to schedule for the visit. I would say that as your therapists are learning to use this technology, it may take them more time. May take you more time to give the patient instructions on how to position themselves and that sort of thing. As you learn, you probably get more efficient. But you'll need to determine what does that time frame look like and how do you put that on the schedule. Your team still needs to do insurance verifications. So just because you're delivering a different model doesn't mean those steps go away. And there are specific questions you want to ask when you verify the patient's benefits and their insurance as it relates to telehealth. For patients who don't have insurance coverage for this delivery model, you want to determine what are you going to charge the patient for a telehealth session. How are you going to document? And I will share with you my thoughts about that. Really, it's not much different than documenting your normal visit, but you will want to document that you are delivering the service via a telehealth visit. You want to put your consent forms together. You want to put your staff policies together. So what kind of security does your staff need on their internet, internet connection? What kind of policies do you have in place? Who's going to provide those services? Who's allowed to provide those services? And then a policy on how you would deal with emergencies if a patient had emergency during a telehealth session. So we all want to be on the same page, delivering quality service, delivering it in an effective and efficient way. Our next, or along with our processes that we're going to develop, is our staffing model. Which therapists are going to perform these visits? Are all of our staff going to do this? Or are we going to split up and some continue to do our in-clinic visits, or maybe we're doing in-home visits? Which therapists are going to perform these visits? Are they tech savvy? What's their internet capability, especially if they're delivering services from home? Does the State Practice Act or payer dictate that it has to be a clinician, and that it's not that you're not allowed to do the service as an assistant? So all of those pieces and parts need to be discussed and determined before you start your program. From where are you going to provide this service? Are you going to do it in the office, or are you going to perform that from a home setting? If you are doing on-site visits and telehealth visits, are you dividing staff, or are your staff doing both? I would say that it's going to be easier for a staff to do the telehealth visit if the staff already has a relationship with the patient. They've already evaluated the patient. They know a lot about the patient already. So that would be probably an easier transition to learning telehealth than starting with a patient that's brand new. So make those considerations. And then how are you going to pay staff for these? Are your staff still full-time staff and they can do a full-time model? Are they part-time? Are you paying per visit? So those kinds of details you're going to want to work out. In your process, you want to make sure you have a good solid process for insurance verification. And so here are some suggested questions. Do you pay for telehealth services provided by PTO or speech? Is there an authorization process? Do we need to get special authorization for a telehealth service? Are the regular therapy codes covered? Can we bill our regular 97,000 series codes, or are we going to have to bill unique codes for this particular payer? Place of service is a code that we put on our claim form when we file a claim to tell the payer where we're providing that service. And so, for example, in the outpatient therapy world, when we do an outpatient therapy visit in a traditional office-based setting, we use place of service code 11. If we provide outpatient therapy in the patient's home, we use place of service code 12. Place of service code 02 says to a payer that we are performing teletherapy services or telehealth services. So place of service code 02 is going to be used when providing telehealth unless a payer gives you specific other directions. And I will say that during this period of time, we are finding that a lot of our payers want to handle telehealth really uniquely. And so there's not one answer fits all for all of our payers. So your billing department's going to need to be a little savvy in filing these claims and getting them all correct based on the payer's unique instructions. Some of our payers are requiring additional modifiers on the code, on the CPT codes. So some of our payers are giving instruction to put a GT modifier on the claim. Some of our payers are saying put a 95 modifier on the claim. So again, your insurance verification team needs to get some specifics about how each payer in your market's going to handle this. And I would suggest a nice little spreadsheet or cheat sheet for your clinic on how each individual payer is going to handle these. The other question to ask is, do regular co-pays, co-insurance, and deductibles apply? Right now, during the COVID-19 pandemic, we are seeing some of our payers waive co-pays and deductibles and co-insurance if the patient is doing a telehealth visit instead of a traditional in-office visit. So you might find that there is less cost sharing with your patients right now during this time of crisis if you're providing this alternative delivery model. And then you got to ask your regular questions too. So, you know, what are the visit limits? What are the financial limits? You know, do the telehealth visits count towards the regular visit limits and that sort of thing? So ask those questions as well. The next step, step 6, is to train your staff. And so I would recommend that you do training specific to telehealth visits for therapists. There's a lot of good online webinars for that. It's not the same as an in-person visit, so your therapists need to get educated. I would recommend that you do some test visits on each other. We might all need a little therapy right now, right? So you want to make sure that you're comfortable with the technology and you're comfortable giving directions before you start working with real patients. Eye contact is important. How do you keep that eye contact with the camera? It's difficult because I want to look down here at the computer instead of making eye contact with the camera. Smile, be nice, have your professional background. All the things are important. Have a plan in place of what to do when connections go bad so that you can give your patients direction. You can, the patient has your phone number before you start the session so that they can call you if they have a difficulty. You've got their phone number so that you can call them if you lose the connection. How to talk a patient through connections if they're struggling. I don't know if any of you have ever tried to talk to parents through using a computer technology that maybe they're not familiar with, but how do you do that efficiently and effectively? So that's an important skill set. How to handle that emergency that we talked about. And then what are your policies and procedures, and make sure that all our staff are on the same page. We know what we're going to do. We feel comfortable. We have a playbook to go by, and we know how we're going to document. We know how we're going to code a bill, and we know how we're going to use this technology effectively, efficiently, and safely. The next step is developing your patient communication tools. So we want to have instructions that we give to the patient prior to the visit. What to expect from a telehealth visit? Why would I even want to do a telehealth visit? Why is it helpful? What are the limitations to a telehealth visit? And then, very importantly, how am I going to start this visit? So I'm scheduled with you on Monday morning at 9 o'clock. How do I get connected to you? How do I get hooked up, and what should I be prepared for? So I alluded to this earlier, but you're going to see Jennifer Gamboa and myself do a telehealth visit on a future webinar, and you're going to see Jennifer evaluate me as a patient. And this is the sample letter that I received from her clinic. And so in this letter, as an example, gives you some really important information as the patient. Welcoming you to therapy, giving you some details about how the session's going to go, telling you what platform they're using, and you know, I got an email with a link to how I connected to her for the visit. They'll giving you some instructions on what you're going to be asked to do during that session, and then what's going to happen after that session. Then some specific instructions about what the patient needs to do during the session. So tighter fitting workout clothes where the therapist can easily see the affected area so that the patient can easily move. Select a safe place in your home where you can do movements from a seated, standing, and lying down position. And so you're giving that patient some instructions on thinking through before they start their session where they need to be, where they need to put camera, that sort of thing. You'll see her treat me, and we're going to treat my neck. And so I am really doing, one for the team, in that you get to see me in my tight fitting workout clothes, struggling to move my head. So I'm just putting it out there. That's going to be interesting to watch, but hopefully for the good of the cause and giving you information on how this works with a real patient. Here's just a sample connection instruction. This is from a platform that exists that many therapists are using called doxy.me. And so these are the instructions that they have that you can provide to your patient for connecting. And it's actually on their website for the patient to click on and get instructions on how to connect for a telehealth session. So again, you want good instructions for your patient to follow. You want them to understand what to expect and what they need to do to plan for their session, and have good information on how to connect with you when that date and time rolls around. So then our next step is we want to make sure we have documentation guidelines and we know how to bill and code. So we want to document the visit just like we would a regular visit. All of those things are still important. That hasn't changed. But in the beginning of our documentation, we want to make a statement that we are performing this service via virtual healthcare visit, and why we're doing that. Why are we seeing the patient via telehealth versus in the office? And right now, most of our statements are that we're doing it because of the COVID-19 pandemic, and the patient wants to be treated safely at home. Again, most of the time we're going to use place of service code 02, so you want to make sure that you know how to do that in your EMR systems. And again, some of your payers may require some additional modifiers, so you want to know what those are and how to put those into your system. I just want to make a little bit of a word about payment, but just a cautionary tale too. I think I told you today is April 4th. This information is changing almost daily. So if you're doing this later in May or sometime later, you're going to want to follow up, and I've given you a good reference here at the bottom to check the APTA telehealth page to see a modified list of who's covering telehealth during the pandemic crisis. And many of our payers are covering telehealth, but only for this time that we're in this emergency declaration. So don't assume that that's going to stay the same once this is over with. So just be aware of that. And also, many of our payers are putting some limitations on telehealth in either the codes that they're paying for, or they're saying they're only going to pay telehealth specific to in-network providers. So you're going to want to go to this reference website, click on the details, open the payer's website, look at the information, and get the details on what specifically is covered for the payers in your market. So just to give you some general guidelines on what national payers are doing, right now, as it stands on April the 4th, Medicare is only covering e-visits. Therapists are still not on the list of approved telehealth providers. So I'm going to be doing a full session on e-visits to give you the difference in what an e-visit is versus telehealth. Aetna is paying for e-visits and regular telehealth for therapy. There is some restrictions on CPT codes that they're allowing, so you'll want to look at that policy. Cigna is also covering regular telehealth at regular reimbursement rates, but they have a limited code set that they're covering. So they're only covering the low complexity and moderate complexity evaluation codes, and then Therex for 2 units for treatment session. So be aware of that. United is also covering regular telehealth with a list of regular CPT codes. Again, the code set's a little bit limited, so you want to take a look at that and look at what United is doing. Again, regular reimbursement rates. Humana, currently, as it stands right now, is only covering e-visits, and they typically follow Medicare. So if Medicare changes their mind and adds therapists into the list of approved telehealth providers, I would expect Humana to follow suit. I can't say that for certain. Blue Cross Blue Shield is typically state specific. So you want to check with your state association or check with your state Blue Cross Blue Shield website to see what they are doing. Also, some states have a government mandate. So, for example, Massachusetts, the governor has mandated that all payers in the state cover telehealth visits at the regular rates during this COVID-19 pandemic. So that information is also on the apta.org telehealth website. So go to that website, scroll down to about the middle of the page, and you're going to see list for the national payers, for state-specific payers, for workers' comp, etc. So I would encourage you to check that out and read the full reference so that you know and develop your own little cheat sheet for the payers in your market, your state. Step 9, developing a marketing plan. Physicians want to hear from you. What are you doing during this pandemic? They're excited that you can continue to provide care for patients and keep them out of the doctor's offices right now. So you want to make sure that you engage your physicians, that they know what you're doing as your plan. You want to make sure you've communicated with your staff, that everybody knows what's going on, and that you're also marketing these services to your patients. Step 10, evaluating effectiveness. So once you get up and rolling and you're doing some of these, you want to see, how are you doing? Are you effective? Are your patients happy? Do you need to make some changes? Do you need to modify what you're doing? So I would encourage you to continue to collect your outcome data and compare your outcome data for your in-office visits to your telehealth visits. Bring your therapist together, have some daily huddles to discuss what problems and challenges your therapists are having and what kind of solutions can you come up with in solving those problems. And then make sure you're doing some patient satisfaction surveys regarding the telehealth visit and getting that feedback and then acting on that feedback and making changes to your processes and your the way that you're doing your business. We're not all going to be perfect at this as we start, and so we want to make sure that we don't leave this step off. All right, so just getting into some details. Like I said, you're going to actually see a visit conducted, but I want you to just a few tips for success in performing an e-visit or a telehealth visit. So setting up the visit, you want to make sure you send a welcome letter. I gave you an example, setting the expectations, telling the patient how to connect, getting the patient's phone number for issues and making sure they have your phone number to know how to call if they're having problems on the day of the visit, what to wear, where to have the camera, lighting, area, room to move, that sort of thing. And then any consent form that you want them to sign and get back to you, or they can show it to you. Then setting your own environment up. Is it professional? Is it private? Do I have room to move? And am I dressed professionally? Nobody wants to see you in your pajamas. So put your makeup on, do your hair, guys probably don't need to put your makeup on, but be professionally dressed and be professional. All right. First visit, you want to make a good first impression, so connect a few minutes early. Some of your patients are always early, some of them are late, but you don't want to be late. Make sure you're connected at the time that you're supposed to be there. Be prepared to help patients troubleshoot issues. Patients may have issues connecting. They may have lost the email that you sent them to click the link, so you want to make sure that you got a plan for that. Welcome introductions. Many of our state practice acts actually ask us to specifically have a methodology to identify the patient and for the patient to identify the therapist. So best practice would be to have your driver's license available and your patient have their driver's license available, and you share identification. This is me, and then you check to make sure you're treating the right person. Before you start the session, you want to get some emergency information. So verify the patient's physical address and make sure you have that in front of you, because if something were to happen with the patient's home alone, you want to be able to call 911 and give the 911 service the patient's address. So you need to have that right in front of you. Know who's there with the patient in the event that there's an emergency, and then have that person's information available so that you can contact them if something were to happen. You also want to explain to the patient some of the risk information that we discussed. So what is the security of this connection? What's the potential for someone to be able to see this connection? You might want to explain that you may not be able to see everything clearly. There may be some issues with the connection. We may lose a connection. This is what you do if we do lose a connection. And then it's not the same as hands-on care, and explain what the differences are. So make sure your patient completely knows what's going to go on and what to expect during the visit. All right, when you're conducting the visit, you want to think through this before you start doing these. And so again, on the demonstration, you'll be able to see some of this, but think through this before you start. And again, I recommend that you practice on your colleagues, but what functional testing can you do that doesn't require you to put hands on the patient? One of the things that Jennifer asked me to do was some functional testing, a sit to stand test, a 2-minute marching test, a push-up test. So some of these tests that you have age norms for to see what the patient can do. Be able to, step back from the camera and demonstrate movements. If you're having the patient to do shoulder flexion, that you can show them, that you can turn in different directions and show them what you want to do. You might be giving directions about, give yourself resistance. So think through what your demonstration needs to be. Right and left is a problem when you're doing audio video, right? Because it's opposite. So I would be cognizant of that. And so your right's going to be their left. So, just be aware that they're mirroring your movements and not necessarily, it doesn't look the same on the video, right? Don't hesitate to ask the patient to move where you need them to be and give specific instructions like, back up 3 steps or move the camera. Ask the patient to move the camera if you need to move the camera. I found that I was using my iPad during the session, and I have a keyboard on it and it stands up, but sometimes I need to change the angle. So I usually yoga block behind the iPad to position the screen so that I could be seen correctly. So, give the patient some suggestions. Hey, if you got a book, you can prop up behind that. So just be thinking through that before you start. Give the patient lots of verbal cueing. This is something you're going to use is, I always say that a lot of what we do in therapy is because of what's in your brain, right? So it's being able to give patients directions, being able to correct their techniques, being able to give them direction, being able to see movement patterns that are not correct, being able to correct those things. So you're going to be getting a lot of verbal feedback during the session. So make sure that your patient can hear you and that you can hear them. If you've got a patient that you're worried about their safety, engage their caregiver, to help them and to assist them. And so set that up ahead of time and make sure you make that part of the expectation. You might need to be creative with equipment needs. They may not have a half-pound weight, but they might have 2 soup cans. So, you need to be thinking about their equipment needs and ask what the patient has. I happen to have almost a full-blown gym in my basement. So during my session, when I was asked, do I have a TheraBand? I actually did. So, don't just assume that a patient might not have any equipment. They may, it just might not be in the room that they are in at the time. So ask questions, be creative, and think through these things before you start. Other things to consider when setting up telehealth is a secure way for patients to get you their paperwork. Email's typically not secure. So, do you have an online portal they can use? Do you have a DocuSign type system that's HIPAA compliant that you can use? So just think through that ahead of time for them to get you their history, their consent forms, and all of that sort of thing. How are you going to get the patient their home exercise? You're certainly not going to be handing them a piece of paper. So, are you using a program like MedBridge? Are you doing videos that you can securely send to the patient? Jen sent me some videos, which I really liked because I need to refer back to them and, what did that look like again? So I think videos are really helpful. What are your contingency plans? I think I've said this like 15 times, but it is important because everybody seems to be working from home right now, and our internet systems may not be as stable as they normally are. So, what are your contingency plans if connections fail? And most importantly, do a lot of smiling, laughing, and have some fun. I'm a big fan of a sense of humor, and we can't lose our sense of humor in any situation. So, have a good time. If you are relaxed, if you are confident, your patient's going to be confident that you know what you're doing, and they're going to enjoy the experience. So I think that's just as important, developing that rapport just like you would if the patient's in front of you, and having confidence that you're helping them is a really important thing to keep in mind. So I have some references for you, but I do want to say that I was evaluated, and then I've had 1 treatment session, and I'm doing my home exercises consistently. I'm a very compliant patient, and it's made a big difference for me. So I'm pretty excited about what we can do with this technology to bridge this gap of time while we are working to keep our patients safe and keep them moving towards their plan of care, and keep our patients engaged and out of facilities for the musculoskeletal issues or their other issues that we can help them with alternate delivery models during this pandemic. So you have a lot to offer, and I would say thank you for what you're doing to keep your patients engaged and safe during this pandemic. So references are listed here. I mentioned this special private practice section impact publication that was published as a special edition, and it has a great article on tips and tricks to start telehealth tomorrow. So be aware of that, and you can certainly pull up this reference and take a look. And then there are tons and tons of references, but I've given you a few that link you to a lot of good information. So the APTA telehealth page, the private practice section page, for those of you who have your malpractice insurance through HPSO, they have a nice risk management article about delivering telehealth. There's some information about a Duke study that you might be interested in. So all of that is good information for you to have. So I hope this information is helpful. In our next session, we're going to cover e-visits and what the difference with e-visits are, and what is an e-visit. So see you in the next session.